Hello, everyone. Today, I want to talk about something very common, especially in women. And if you've ever experienced it, you know it can be very, very uncomfortable. Let me ask you this. Have you ever gone to the bathroom and felt that burning sensation or noticed your urine just doesn't look right or even smell right? And something in you said, yeah, something is definitely not right. A lot of times it can be called a UTI. A UTI is a urinary tract infection, and that simply means bacteria has gotten into your urinary system, most commonly your bladder. Now, most people do have symptoms, but some people may have very mild symptoms or no symptoms at all. But when symptoms do show up, you might notice that burning sensation when you urinate, feeling like you have to go to the bathroom all the time. But when you go, you only get a drippity drop, drop, drip. Sometimes you can feel pressure or heaviness or discomfort in your lower belly area. And for some people, especially if the infection starts moving higher, you may feel pain in your side or your lower back. And that's what we call flank pain. And it can feel like a deep ache or soreness on one side of your back, right under your ribs. Sometimes it's constant, and sometimes it comes and it goes. But it's your body's way of saying the infection may be traveling. Now, with the UTI, there are some other signs people don't always talk about, such as that foul smelling odor in your urine, or urine that looks cloudy, urine that looks darker than usual, or even blood in the urine, which may look pink or reddish. And sometimes people notice that strong odor and think it's something else, but actually it can be a UTI. Now, in older women, UTIs don't always show up the typical way. Sometimes, instead of burning in frequency, you may notice they're confused, or there's a sudden change in their behavior, weakness, or they're just not acting like themselves. And a lot of times, families don't realize this can actually be a sign of a UTI. And if a UTI is left untreated, it can spread. It can move to the kidneys, and in more serious cases, it can lead to something called sepsis. Sepsis is when the infection spreads into the bloodstream and the body has a severe response to it, and that's considered a medical emergency. So if you notice confusion, especially in older adults, fever or chills, back or side pain, even nausea and vomiting could be signs and symptoms of a UTI. Don't ignore it. Get medical attention. Now, let's talk about who's more at risk. Women. Yes, women tend to get UTIs more often because of how our bodies are made. It's easier for bacteria to travel into our urinary tract system. Being sexually active. Sex can sometimes push bacteria back into the urinary tract system, which can lead to the infection. Holding your urine for too long. When you hold your urine for long periods of time, it gives bacteria more time to grow. Not drinking enough water. If you're not drinking enough fluids, especially water, you're not flushing your system out like you should. Diabetes, yes, diabetes. When your blood sugar is high, it can make it easier for infections to grow inside your body. After menopause, changes in the body after menopause can make it easier for UTIs to reoccur. And using a catheter. A catheter is a tube that drains urine, and it can allow bacteria to enter the urinary tract system as that catheter is placed. So, how can we prevent UTIs or decrease our incidence of them? Drinking plenty of water. Don't hold your urine for long periods of time. And always, after using the bathroom, wipe front to back. And always try to remember to urinate after sexual activity. And last but not least, avoid irritating products. Be careful with things like scented soap, sprays, or harsh products in that area. They can cause irritation and throw your normal flora off balance. Now, most UTIs are treated with antibiotics, which are medications that help kill the bacteria that's causing the infection. And some common ones your provider may prescribe, these are not all of them, but just a few, are medications called Macrobid, Bactrim, and some cases Cipro. And this part is really, really important. Even if you start to feel better when you start taking antibiotics, you still need to finish the entire prescription, because stopping early can allow the infection to come back, and sometimes even stronger. At the same time, while you're taking antibiotics for a UTI, it's important to stay well hydrated with water. Drinking plenty of water helps your body flush out the bacteria and supports your healing process. Always, and I mean always, check with your provider, especially if you've been told to limit your fluids, because everyone's situation is different. And I also want you to take note, some medications or irritants like aspirin for some people can make bladder symptoms feel worse. Now, a question that often comes up is, when do I seek a urologist? Well, that's a good question to ask. You should consider seeking a specialist if you're getting UTIs frequently, if your symptoms keep coming back, if the antibiotics are not working, or if there are signs of kidney involvement. So when you look at it, UTIs are common, but your body will usually give you signs when something isn't right. You can't keep ignoring it, and getting treatment early matters. And I always like to remind people, taking care of your body matters. The word says in the book of 3 John 1 and 2, beloved, I pray that you may prosper in all things and be in health. That includes paying attention to your body and responding when something is off. If this video has helped you, please like, share, and subscribe.